Hi, my name is Dr. Michael Kaplan and I'm the Regional Medical Director with NextCare Urgent Care. Welcome to our first web video blog. Here's a little introduction to who we are and what we hope to accomplish with this web series. NextCare Urgent Care is one of the nation's largest providers of urgent care services with over 50 clinics throughout the U.S. Every day we see an average of 2,000 patients, children and adults, with ailments ranging from colds and cuts to work-related injuries. Combined with x-rays and on-site lab testing, we treat all your urgent care needs every day. We see lots of seasonal injuries at common times during the year. For example, during the fall, we see an increase in patients suffering from allergies. Recognizing these trends can help us bring you prevention strategies and tips prior to falling prey to these common ailments. If you have a question, please feel free to call us at any time. Remember, these videos provide useful tips and suggestions to aid in prevention, but they are no replacement for medical care when needed. If you have a medical emergency, go to the nearest emergency facility or call 911. Also, consult a licensed medical provider if you are sick or hurt. Now, our first topic, the 5 most common school sports injuries. It's back to school time. Soon our sons and daughters will be putting on their new shoes and heading outside for a fall sport like football, soccer, tennis, volleyball, cross country, and lacrosse. Hitting the field can be a fun way to increase activity and combat the ever-growing epidemic of childhood obesity. But invariably, every year we see hundreds of patients come through our doors with common and preventable sports injuries. Here they are, our 5 most common sports injuries. Ankle sprains. If you sprained your ankle, you've likely overstretched or torn the ligaments on the outside of your ankle. Talk to your doctor about how to prevent these injuries to get you back on track. Careful training should include agility and strengthening programs. Muscle strains. Overstretched hamstrings from activities such as hurdling or long-distance running can take 6 to 12 months to heal. Go easy on the muscle and talk to your doctor. The proper prevention here is stretching before and after your run. Dehydration. Infants and children are more likely to become dehydrated than adults due to their body size and tolerance to the climate. Since they weigh less, their bodies turn over water and electrolytes more quickly. The elderly and people with illnesses are also at higher risk. Drinking fluids is usually enough for most dehydration cases. Encourage your child to drink extra fluids or suck on flavored ice pops. Electrolyte solutions or freezer pops are very effective and are available at your local grocery store and pharmacy. Shin splints. Think rice, rest, ice, compression, and elevation. Over-the-counter pain medicine can also do the trick. If you think you may have a stress fracture, see your doctor or urgent care facility. Concussions. The number of children treated in the ER for concussions has increased significantly. Concussions are more likely in high school-aged athletes, especially those participating in football and ice hockey. One study concluded that the risk of concussion is also higher in girls. Concussions are to be treated so seriously that the AAP, American Academy of Pediatrics, recommends that children who experience multiple concussions consider giving up contact sports for good. The following is a list of symptoms common to concussions. There you have it, the top 5 common sports injuries. Remember, before your child starts their fall activity, visit a local NextCare Urgent Care for a sports physical. For more information about this or other health-related topics, please visit our website at nextcare.com and subscribe to our YouTube channel. Thanks, and remember, when feeling great can't wait, come visit us at NextCare.